Hello everyone, I am Dr. Girish, consultant nephrologist and transplant physician at Manipal Hospital Hebbal. So today I am going to talk about some of the common kidney problems that occurs in youngsters and that can be quite troublesome. So in the earlier days, when we talked about kidney disease in youngsters, we were talking more along the lines of autoimmune disease or certain inflammatory diseases which didn't have a definite cause that affected the kidneys in youngsters. But nowadays, with the prevalence of hypertension and diabetes going up, in fact, hypertension has become one of the commonest diseases that tends to affect youngsters. And why is this change? There are a number of factors this can be attributed to. One of the important factors is the diet. The modern day diet is definitely not as healthy as the olden generation diet was. Now, not only the diet but also our lifestyle and the habits that we have inculcated over a number of years, sedentary habits, lifestyles, etc., all this has factored in and made these non-communicable diseases such as diabetes and hypertension come up right on top of the list. Now, how do we address this? It's important to start modifying your diet and lifestyle at a very early age. In the earlier days, we used to advise modifications to people who were diagnosed with diseases. But the current trend is that prevention is better than cure. So, modification of diet and improving your lifestyle from the younger age completely modifies your risk factors and prevents certain diseases which tends to be affecting the youngsters. Youth are the future of our nation, and kidney disease is a pandemic, and it's important for our youth to understand this, gather information and try and act swiftly to prevent this pandemic. Thank you.
Hi everyone, I am Dr. Deepak Kumar Chitrali, consultant nephrologist and transplant physician at Manipal Hospital Yeshwantpur. Now, as we understand about kidney diseases, we know diabetes and obesity are the most common reasons for developing kidney disease in adults. Now, is it the same with respect to children? Well, the answer is yes. Obesity and diabetes mellitus are on the rise in children, and it is leading to more and more chronic kidney disease in the present era as compared to before. Now, let's start with obesity. As we know, the prevalence of obesity has been increasing day by day, and as per the latest data, the prevalence is about 15 to 22%. Now, when do we call child as obese? If the BMI of the child is more than 95th percentile, then the term obesity is used in children. What are the reasons to develop obesity? The reasons are low physical activity, improper dietary habits, and of course the genetics are the main reason for few children to become obese. Now, with this pandemic going on for last 2 years, the prevalence of obesity has only increased, and which has led to associated comorbidities like diabetes mellitus, hypertension, dyslipidemia, cardiovascular abnormalities, as well as chronic kidney disease. Now, how obesity can lead to kidney disease? It on its own can lead to kidney disease. So, what is the mechanism of it? Well, the mechanism is it acts directly on the kidney. Because somebody is obese, they can have glomerulomegaly. Now glomerulomegaly is a condition where the glomerulus, which is the functioning unit of the kidney, we call nephron, and the glomerula is a part of nephron which enlarges, and once it enlarges there will be hyperfiltration. Once there is hyperfiltration, it can lead to progressive secondary FSGS, what we call it as secondary focal segmental glomerulosclerosis. So this in turn will lead to developing chronic kidney disease over a period of time. Now, how do we treat this condition of obesity and chronic kidney disease? Well, the treatment has to be focused towards obesity at the outset. And obesity in children is difficult to treat, isn't it? It needs counseling to the children, it needs counseling to the parents as well as counseling to the entire family. Now, once there is thorough counseling and identification of this particular issue, the treatment is based upon lifestyle management, which includes a proper and a strict dietary recommendation coupled with increased physical activity, and this can lead to reduction in the obesity as well as reduction in the chronic kidney disease on a long run. Now, the other important aspect what can cause chronic kidney disease even in children is diabetes mellitus. As we know, diabetes mellitus is one of the most common cause of chronic kidney disease in adults. Hence, in children also it causes chronic kidney disease. There are two types of diabetes mellitus, as we know, type 1 and type 2. Type 1 is not associated with obesity, whereas type 2 diabetes mellitus is associated with obesity. Now, combination of diabetes mellitus and obesity, it's a dreaded combination because both can independently lead to chronic kidney disease, and when they act together they can lead to chronic kidney disease much faster, and child might have severe kidney issues. Identifying obesity early or diabetes early in children can go on a long way to prevent developing chronic kidney disease. We had a discussion about this obesity and type 2 diabetes mellitus, and both which can lead to serious kidney problems. So addressing these issues when the children are pretty young becomes more important. Counseling the family, parents, counseling the children about these conditions becomes really important. Thank you.
I am Dr. Ravi Shankar, consultant nephrologist at Manipal Hospital Whitefield, Bangalore. So, we can diagnose kidney disease by asking the patient about whether they have symptoms of swelling of the legs or face, or if they have easy fatigability. That means whenever they do a bit of exercise, they get easily fatigued. And in addition to that, they might have sometimes discoloration of the skin or itching of the skin, and then sometimes they were told by other doctors that they have severe anemia, that means low hemoglobin, which could be because of an underlying kidney disease. These are some of the simple symptoms which can tell us like that patient might have an underlying kidney disease, and we can diagnose the kidney disease very easily by doing simple tests, so such as urine examination, looking for the protein in the urine and blood in the urine, and a blood test called serum creatinine, which is easily available in most of the labs, which will tell us whether the patient has kidney disease if it is more than the normal values. And by doing a simple ultrasound examination of the abdomen, looking at the size of the kidneys and then appearance of the kidneys, we can make out whether the patient has a kidney disease if they have altered size and appearance of the kidneys. So if you see a patient in a clinic, and then I'm going to ask all these simple questions, and then I'm going to order 3 tests which I mentioned earlier, which will tell us like very clearly whether the patient has an underlying kidney disease in him or her.
This is Dr. Prakash, nephrologist from Manipal Hospital Malleshwaram, and today I will be trying to touch upon various aspects of dialysis. What is dialysis? Where is it done? Who are the people who need to undergo dialysis? And what is the type of dialysis and frequency of dialysis? So as you all know, dialysis is a procedure wherein we clean the blood of the waste product which get accumulated when the kidneys don't work adequately. So the
Dialysis is done in two situations. One is in a temporary dysfunction, what we call as acute kidney injury, and the other one is the permanent dysfunction, the chronic kidney dysfunction. And if you have to know what is the burden of this chronic kidney disease who undergo dialysis or who end up in end stage disease, is that according to the statistics based on the 2018 year, there are almost 1,75,000 patients on dialysis and around 2,25,000 who end up in end stage kidney disease. Now coming to the type of dialysis, I would be touching upon various kinds of dialysis which can be offered to our end stage kidney disease patients. The topmost among that is the hemodialysis, which is a machine operated one. Hemodialysis is the commonest mode of dialysis for all our patients worldwide and also in India. Now coming to the next issue about the frequency of dialysis, how frequently one needs to be dialyzed. World over or globally, generally they do 3 times a week of dialysis. In our country, majority of them do twice a week of dialysis, and at times we do get patients who come once in a week because of financial constraints. The next big mode of cleaning or cleaning the waste products from the body would be the peritoneal dialysis. Unfortunately, there is poor penetration of this procedure in our country, and around 8,500 PD patients would be there in the country as of 2018 or 19. And as you all know, the greatest positive thing about peritoneal dialysis is that patients can have their therapy at home. They don't need to come to the center. That is the biggest advantage. And people with comorbidities, especially in the form of cardiovascular disease, it is an ideal choice. And people who can't travel a distance also would benefit from this